In this session, I introduce how an interoceptive posture picture opens the door to connecting biomechanics, interoception, and active inference into the unified biobehavioral BAM framework for chronic low back pain, and most especially to significantly mitigate the risk of acute pains becoming chronic.
Welcome to the 5th Applied Active Inference Symposium. So I will let Stephen introduce this.
Interoceptive Posture Pictures, IPPs, are a tool and a methodology for active inference-informed neuromusculoskeletal therapy, muscles, bones, joints, being able to move well, which is why it's also an amazing tool for anyone who wants to move well as they age. I'm a neuromusculoskeletal clinician and educator, and to me, active inference is a framework to connect and shape people's mindsets towards healthy behaviors in both body and mind. Now, I understand that AIF is part of a broader understanding for PhD scientists, researchers, and others looking at how to model from a computer or AI point of view, as well as understand from a personal point of view how humans work in a whole new light. I believe that for clinicians, patients, and the public, active inference can play a role in preventing the progression of, I hurt my back pain, I overdid it, neck pain, common stress, going from acute to chronic. And especially when chronic low back pain is the leading cause of disability globally, and neck pain and tech neck and normal daily stress is part of a somatic pain that a lot of people live with in their lives. Active inference can help clinicians and people help themselves. In addition, it's also a way to mitigate full risk for aging boomers, as well as to address mild concussions, things called MTBI or PPCS, persistent post-concussive syndromes, after accidents or sports injuries, as well as helping everyone, including you, to connect with your interoceptive sense and your sense of balance, your sense of your overall body alignment, to have the zones of postural mass balanced, and how those zones of postural mass, those posture zones, move in everything you do. Balance, align, and move. We call that BAM. My name is Dr. Stephen Weiniger. I'm a doctor of chiropractic. I practiced for 26 years. For the past 20 years, I've been lecturing around the world about teaching people to move well. I'm a diplomate of the International Academy of Neuromusculoskeletal Medicine, and I'm very proud. Last year, 2024, I published my first peer-reviewed paper in Frontiers of Neuroscience. It really was a very cool thing because I had wanted to, but never wanted to research, and I had gotten a whole new understanding of what it takes to be a PhD level researcher. I've written books, I've lectured literally around the world, and when I saw the word cloud for this conference, the first thing that popped out to me was energy principle and clinical. And the clinical application of this is something that I think is tremendous, and it's not yet been realized, especially in NMS care. So the title of our paper, Interoceptive Posture Awareness and Accuracy, a novel photographic strategy towards making posture actionable, came from my work teaching, which works with, well, this is some of the disclosures that I do need to talk about. Bodyzone.com, which is public health awareness and ideas, largely focused on posture, and posturemonth.org, which is a public health awareness campaign, and strongposture.com, which is a self-care campaign and tools for professionals mostly to give to patients to work along with those patients. My main interest now is cesoup.com, which is online continuing education for professionals. We teach doctors, therapists to incorporate the ideas of using a grid, the posture zone grid, which is a tool to objectify a simple posture picture. And we certify people with this with posture practice. Disclosure, these are things that I do have an economic interest in. What you have an interest in is your posture, and everyone does. Posture isn't good or bad. That framing is wrong. It's old. Posture is functional, which means it's strong or weak. And the overlay with active inference is that maximizing the symmetry means reducing the prediction error, which saves energy. Energy is the thing that life is all about. Efficient movement that generates a fluid flow is not wasting energy. And every unique body selects their movement strategies that match their internal model's expectation of what's going to occur next, moment by moment. And that's why good static posture and dynamic motion are not the same for every body, because not only is your body different from mine, but our experiences are different in life and what we've done and who we are. I'd like to start to get you thinking about your body and how your body is basically working in what you do. So my question for you is, as I stand here right now on an overall biomechanical basis, and biomechanic means muscles and joints, how they're working together. Right now, is my body balanced? I've asked this question around the world to many audiences, and people invariably say, no, he's not balanced, no. And you're probably saying that right now. But remember the question, on an overall biomechanical basis, is this body balanced? And the answer is, of course it is, because I'm not falling down. Which brings me to the point. Your posture is how you balance your body. It's what you're doing to maintain verticality. Humans are the only obligate biped on the planet that is a mammal. Birds, also obligate bipeds, some other creatures in different places, but humans are the only mammals. And mammals are unique because we've learned to do a number of things, one of which is maintain our internal energy at the same temperature. The uniqueness of human bipedal moment-to-moment balance requires active inference to stay vertical. Maintaining that takes a huge amount of the free energy that we have. And conserving energy is a priority for anything that's alive. This is a law of nature. If there's an inferred prediction that has a higher energetic cost or a greater inefficiency, the organism is going to have a negative perception of that action and tend to shy away from it. When that persists for a while, it can be felt as stress, fatigue, pain, or just feeling bad. Human activities require accurate balance control, from simple standing to complex sports movement. Falling down is something that we don't want to do. When you watch children learning how to walk, they fall down and they bounce back up because they're made differently. But as we develop, we become less resilient to falling down because we've learned how to stand tall, and our bodies develop in that direction, which is also why losing your balance in daily life is an early warning signal for problems breaking down with your health. And you may say, well, I'm not old enough to have that problem yet. But if your balance is weakening, you're getting a big flashing yellow light to do something differently. And balance assessment of how your body is standing, both statically and dynamically, is a sensitive indicator of neurologic health. In 2012, maybe 2013, I saw a TED Talk by Bud Craig, and it got me interested in interoception. I picked up his book, read it, How Do You Feel? And it sounds like an emotional, touchy-feely book, but the subtitle really got me. It's an interoceptive moment with your neurobiological self. The premise of this, based on a neuroanatomist that spent his time literally tracing where nerves in the body go, is that the insulin, deep part of the brain, is where your somatic feelings of your body emerge from. And there's a sense that drives this called interoception. And the next question becomes, well, what is interoception? I mentioned before that mammals are warm-blooded. Mammals have to control their internal temperature. And that began a process of controlling what's happening inside our body to different degrees for different mammals in different ways. Humans do it differently. And we've developed cognition in ways that have allowed us to socialize and to project our feelings from ourselves onto other people and to have abstract thoughts about those in cognition. And our whole progression over this past 6 or 7 million years, we've developed a very unique cognition and very unique body and very unique abilities to connect with our body. And focusing on interoception is what the NIH, the NCCIH division of NIH, in the 5-year plan from 2021 to 2025 said, we need more research about interoception because it is a huge and unexplored factor in promoting effective health and in addressing many syndromes and diseases of modern life, the stress and the many problems developing from the incursion of technology into the activities of daily living. You probably know what I'm talking about. The definition of interoception from NIH is the representation of the internal world of an organism, which includes the processes by which the organism senses, interprets, integrates, and regulates signals from within itself. Now, if you're on the biologic side of this, this is basic. If not, I'm going to do some really fast anatomy to give you a sense of why this is so important from a processing point of view. The insula develops in humans from the sylvian fissure, which is an infolding that's on the side of the brain. That line that you've seen going left to right is the sylvian fissure. When you were developing from an embryo, you went from one cell to a ball of cells to a tube of cells. And at the top, there was an explosion of cells that started to fold in. That stuff on the outside, those cells on the outside are the cortex. And that cortical infolding went down and got buried and became an anatomic structure called the insula. And because it's been so deeply buried, it's been hard to study. So anatomists have not really looked at it as we began mapping things. Well, some of the newer technology has let amazing insights occur about this over the past 20, 25 years. And these insights are exploding. There's a ton of research going on about interoception because when you look again, you'll notice that above that horizontal line, there's a groove going up and down called the central sulcus. That is the line between the blue and the red. And that line between the blue and the red is the line between the sensory cortex and the motor cortex. And the sensory cortex is where information coming in from, and the motor cortex is where information going out. On the coming in and the going out, there's what's called a homunculus. Basically, it's a somatotopic representation of neural connections. You may have seen pictures of a big nose and a big lips, big eyes, and small arms, which represent the point-to-point correlation of the nerves in that part of the body. They're different for the information coming in and the motor control going out. That is why there's a different sensory homunculus and a different motor homunculus. They're roughly the same, eyes, 2 eyes, 1 nose, but the proportions of the neural density is not the same. When you look underneath, when you open up that sylvian fissure and look down between the parietal lobe of the brain on top and the temporal lobe of the brain on the bottom, and you look at what's underneath it, that's where you see the insula. And the insula has a front and a back, an anterior and a posterior portion that controls things in the body. It is the most uniquely complex part of the human brain, according to some people, and it's a really good argument because it ties things together. There's 3 different homunculi. It's not just only the sensory cortex. It's not just the motor cortex that has a representation on a point-to-point. It's also the insula. And that insula has homeostatic as well as autonomic as well as allostatic input into the brain. If you know what allostatic is, it's another big thread in what's occurring in life sciences. And one way to look at it, which is a conversation for a different day, but if you know what homeostasis is, the ability to keep things level within the body, allostasis is to homeostasis as prediction is to reaction. Allostasis is predicting forward, which is one reason why active inference, in my mind, is destined to reshape a lot of life sciences. The low-hanging fruit almost is the biomechanical side of it, because when you start getting into some of the hormonal issues, it becomes far more complicated. Oh, one more rather important thing from Bud Craig's book. Emotional feelings emerge in the insula. Craig writes that the insula optimizes homeostatic sensory motor integration and homeostatic behaviors. Macio and Carvalho wrote a paper about interoception and the origin of feelings. And they talk about how the interoceptive nervous system maps the homeostatic state of the body, and that interoception is structurally and functionally different from exteroception. Different pathways, different processing, everything's different. It's a different aspect of your sensing your body. It's a different way of reacting because of that different sensation coming in, which is why a 2024 paper, what is the role of interoception in the symptom experience of people with chronic pain? A lot of words really well put together, but the bottom line is, in common sense, people who are more accurately connected to their body's inner feelings have less pain less often. People who are inaccurately connected to the body's inner feelings tend to have more pain. And this is why accuracy of somatic bodily prediction is so relevant from a pain point of view, as well as from addressing the causes of the pain and empowering the person to work with and connect with their body more effectively and to feel better about it. And that emotional side of it is one reason why interoception has seen far more attention in the psychological sciences, working with emotions, than in the physiologic sciences. One of the directions within muscle and joint back pain care has been what's called biopsychosocial, to work with the biological and the psychology and the social, because these things affect how people deal with their pain. On a simplistic level of I'm under stress because of bad home life, to a far more complex level that ties directly into active inference of incorrect predictions because of priors, things that have happened before that then make me look at how the world is going to act towards me, which then shapes how I act in the world. And these things are not conscious. Well, they might be, but they don't have to be. In fact, it is a really strong argument to be made that active inference is how we feel. Emotions are inferences about causes of your bodily state, which is your body's best guess about, well, why you feel the way you do. It's okay for me to feel this way. And feelings in general are interoceptive predictions. Your brain predicts the state of your body. Now, pain can be a predictive error signal. If something hurts, there's a torn tissue or a broken bone, that's a prediction that if I move it, it's going to hurt, and that's true. When an expected and an actual body state doesn't match, you've got a prediction error. Feelings aren't passive reactions. They're active inferences on a moment-by-moment basis about what's happening inside your body. I'm afraid to do this. It's going to hurt. Well, try it like this. I thought it's going to hurt. It's going to hurt. Oh, it didn't hurt. When you feel your posture more accurately, when you feel the muscle tension and the mechanics of what's occurring, or the pain more accurately, when you're experiencing your brain's predictions about your body more accurately, then those direct sensations coming into the nervous system are more accurate to reality, and you tend to have less pain. And you're empowered to do things that can then help you have even less pain. One of the biggest issues with musculoskeletal problems is people don't move because it hurts, so they become less able to move, so they move less. And this is a problem that plays out over a long period of time. But hopefully you've been living for a long period of time, and I know many of us hope to live for a much longer period of time. Interoception informs active inference, which is why looking at how someone's balancing their body on 2 feet, their posture. I'm balancing like this. That says something from a biomechanical as well as a social point of view. I mean, our language says it. He's kind of shifty. He looks crooked. He's a stand-up guy. That 2-leg balance symmetry and accuracy of prediction has a dramatic effect. In fact, it's a proxy, in my mind, for how your 1-leg balance is expressed. If I'm balancing like this on one side, or like this, or like this, whatever it happens to be, those motor patterns will be directly reflective of how I move in everything I do. And this is one of the profound implications of active inference. Biomechanics is more than the physics. It's also the predictions and processing that's occurring within my body about how I'm going to move. The old view is that muscles respond to muscle loads and the nerves tell the muscles what to do, and that's all there is to it. The active inference point of view is that muscles activate based upon the predicted loads, and they also preload in that prediction, which means that, well, I'm just tight like this, because your body is preloading based upon actions that have occurred between your predictions and what's happened. And the predictions may be stress, maybe threat. The effect is that people that live with anticipatory muscle bracing, have a protective guarding based upon reactions, are moving in patterns that initially will compensate, would move differently, which is one of the concepts we talk about, that are functional. You can change it if you focus on it. But ultimately, it adapts. This structure changes. When I use this muscle more and that muscle less, this muscle gets stronger, that muscle gets weaker. Your brain distributes the load based upon the capacity of your body. Is it the predicted capacity or the actual capacity? It's the predicted capacity. Not what's actually possible, it's what you think you can do. Even after the injury, the healed tissues may keep on being protected because you've learned that pattern. That outdated prediction is carrying forward in the express pattern of how you're moving your body. And that's why you end up with chronic load syndromes going on, where you're putting more load on something. I'm just like that way. That's the way I move. I don't know. That's just me. That asymmetry of function accelerates breakdown and asymmetrical development, creating a negative spiral. That's the model that we look at, and I believe that this is very much the active inference model that is creating a more accurate way of looking at the world. George Box is a noted British statistician, has a great quote: "All models are wrong, but some are useful." We came out with the idea of standardizing how to take a picture of posture that many clinicians have used, but adding something to it, that one-leg balance concept, as a clinical framework that applies active inference principles to motor control assessment and exercise to enhance outcomes in neuromusculoskeletal rehab, as well as chronic pain management. All you need is a camera. Take a picture in 4 standardized views, looking at somebody from the front, from the side, and then from the front again, balancing on one foot, standing tall, and that's important, and standing on the other foot. These ideas align very much with the word cloud that active inference is something that ties into the energy principle, and it is practical from a clinical point of view. In addition, it's something that the public can do and that can be researched. And this is why I'm talking here right now. Because if you're doing any kind of research in the biologic sciences and you're working with subjects, adding a posture picture to what you're doing is a potential window into their body's prediction from an interoceptive sense, because that's where a lot of this information is coming from. The sensors for your body for interoception are not the same sensors as the sensors for proprioception, how your body's moving. The Golgi tendon and the muscle spindles are dependent upon load and motion, but just feeling something is a different kind of a feeling inside. Interoception is thirst, hunger. It's one of the internal body feelings. Your body's sense of state is an internal body feeling, and the nerves for that go on different pathways up the spinal cord, and it's processed in the insula, which integrates this information with other parts of the body before going out to the motor cortex to guide the motions on a more gross level. And the whole one-leg balance idea is so important because your walking begins with balancing on one foot. Every step you take, you're balancing on one foot and alternating, which is why if you're doing that asymmetrically when you're standing statically, you've burned in that pattern every step you take. That's why in my book, Stand Tall, Live Longer, our second posture principle was balance. The first posture principle, motion. Your body's designed to move. Active inference drives those movement patterns. Movement's about the whole body. Motion's about one arc of motion within the body. Prior beliefs about how your body should move within a global movement unfolds from all the little motions of the joints in that kinetic chain of your body. And the predictions about the sensory consequences of the action drive what you do. And the effort to avoid pain trumps minimizing prediction errors, minimizes energy use. Well, it's harder to walk like this, but it doesn't hurt when I walk like this. You'd be amazed to see how some people walk into the office when they're in an acute pain and what they manage to do to work out, to have an affordance of some kind of a cane or a crutch in different directions. Oh, as a sidebar, I don't like canes. I don't like crutches used indiscriminately. I'd much prefer a staff to keep the body vertical than a cane to let the body fold forward, because that tends to lead very much into now you have a scooter to go around and now you have a wheelchair to go around it. Effort keeps the body moving. Compensatory patterns about how your body tends to move is your body's best inference about how not to have pain and how to move given your body's current biomechanical constraints about the muscles, what they've learned, and the nerves, how they've learned. In other words, functional compensation drives structural adaptation. And then structural adaptation constrains further changes in patterns of motion that change functional compensation, that change structural adaptation in how you move and how you balance in an ongoing spiral of those 5 concepts. Taking a posture picture, seeing how somebody is standing with the instruction of stand tall, show me your best posture, take a step or two in place, just stand tall, and then taking a picture of that can be powerful to engage them in making a change in the body. At the end of this class, I'm going to show you 2 basic and simple exercises you can do to strengthen your balance and your body's alignment. The protocol is to first have someone stand tall with the best posture, take a step or two in place, look at them from the front, take a picture, face to the left, take a picture, face back to the front, have them stand tall, lift the left foot up in the air, and lift the right foot up in the air. It's really easy. 1 step at a time. And what you're looking at is where the head is, where the torso, where the pelvis, and where the feet are. And we get into this in detail with clinicians. This is not the place for that. This is from the paper. And looking at those 4 zones of postural mass, how they're balancing, and the symmetry, especially on the front view of left and right leg coming up. Look something like this. A simple set of pictures. This comes from a paper about changes in interoception in mind-body therapies for chronic pain. This is a systematic review and meta-analysis. Interoception is the perception of physical sensations from inside the body. When they're incorrect, there tends to be more pain. Correcting them reduces the pain. And when you're looking at an interoceptive posture picture, if someone's always leaning to the left, if they're lifting the left foot and the right foot, and they're always leaning to the left, that's saying that their perception of where their body is in space isn't correct, especially if they're not hurting. If they're hurting and it's compensatory, that's short term. But when that's just the way that I am, that's saying that I have changed my body so that I am incorrect about where my body is in space. And that's why systematically focusing attention to strengthen that weak link, which is what we'll do at the end of this class for just a minute with 2 exercises, can make such a big difference, not just in how your body looks, but in how your body feels. Some examples: young lady standing tall, left and right leg coming up. She looks pretty good. Here's a young lady that's also standing tall. You'll notice the pattern of how she's balancing her body on the left leg coming up and on the right leg coming up. She's going way off to her left side with her body when her right knee is going out when she's raising her right leg. Left side, she's keeping much more vertical. The ability to maintain that verticality says something about how her body has learned to move at a very young age. She may have had an injury. This came from a clinician. Hopefully the patient's followed through and she's done well. But the fact that a child this young was brought to a doctor says something. By the way, if you look at that first picture, look at the child's feet, how they're rotated off to one side when she's trying to stand tall. That gives you a hint that there's been some asymmetry trained in that body. And it's something that, especially at a young age, can be improved. He's a young man told to stand tall. You'll notice he's internally rotating his hands so his palms are facing backwards. That's not standing tall. That's not attention. That's a child that's probably been using a whole lot of tech. A clinical posture picture is an experiential perception of that expressed verticality of I'm standing tall. And this is why it's an expression of information coming in from the outside and the inside and your perceptions and predictions. The predictions part of this is so important. Correcting posture is not about telling someone to stand taller. It's about making the body feel the predictions differently and reprogramming that step by step. This is why active inference is such a powerful concept. Those compensatory patterns, the things that can be changed, are inferences about what's going to happen in the body. And a lot of times this is called dysfunction. A simple way of looking at it, if someone's hurting, the weighting of the inputs coming into the body are shifted. You're not thinking about it. Your body just reflexively changes. Your brain is such an amazing tool because it can adapt to different situations. Humans have a great adaptation potential. And there's an old saying, your greatest strength is your greatest weakness. Our flexibility means that we can be trained unintentionally into moving in ways that we don't want to be doing when we think about it rationally, because that's what our body has been trained to do. Our attention, focusing on one link at a time, one piece of the puzzle at a time, can modulate biomechanical efficiency. It's not a one-shot, I fixed. It's one thing that can be changed. Which is why we talk about incorporating biobehavioral strategies, the NMS pros, to help people live well in a tech world. You don't want to let technology ruin your brain or your body because they're connected. Before we go on to showing you exercises that I'd like you to do, I'd like to strongly encourage you, have someone take your posture picture, because the emotional impact of, I thought I was standing tall from the front, from the side, and on one leg balance is powerful. Clinicians know it. I know it from working with thousands of people. And what I'd like to ask you to consider once you've done this for yourself, because if you are a scientist, you're looking at this from a scientific point of view, as we all should be. If there's any part of your research that you're using human subjects, I'd love to talk to you about helping you incorporate more systematic implementations of an interoceptive posture picture as another way to get a window into how that body and individual is predicting actions for their body, and how simple actions can change that by working with that person and engaging that person by educating them about their body and how it moves. This is what we talk about in Stand Tall, Live Longer. Your body is designed to move. That's the first posture principle, motion. The second is balance. Posture is how you're balancing your body. And it's also how you're balancing your mind. A lot of the implications of the word posture is not physical. It's your view on the world, how you're looking at things, where do you stand? And how you balance your body in space and over time is what we're retraining when we're focusing attention moment by moment on a portion of the body and how it relates and links to other parts of the body. In order to balance, because your body moves in patterns of motion that follow the path of least resistance, of how you balance and align to move in patterns. If it hurts to move this way, if it's mechanically constrained, if that's the habit that's caused muscles to get tighter and weaker in one direction and stronger in another direction, that's going to be the way that your body learns to move. Initially compensating, you've learned to move in the pattern that you teach it. But then over time, when this becomes locked in, things become stiffer, it doesn't move as well. Ultimately, you can't move in that direction. I just move like this, where changes in posture and changes in motion cause your body to physically change. It becomes a spiral. It keeps on building on itself over life. My firm experience and belief and hope and efforts drive towards the knowledge that active inference-informed education linked with individualized self-care is an approach that builds both cognitive understanding, that ties together things like pain science and cognitive behavior therapy on a base level, not therapy from a point of view of your childhood and things like that, but being able to control your body in an iterative, ongoing way, arc by arc, strengthen predictive accuracy, to improve sensory perception, to have more accurate processing, and therefore prediction of the motor expression of how your body moves, and then creating a way to track that just by taking an interoceptive posture picture. We have a new course that I literally just finished, integrating interoception and biomechanics. Prediction of where your body is part of what we're creating as a biobehavioral approach to working with neuromusculoskeletal professionals. It's also a way for psychological professionals that are working with chronic back pain to help and to be working with people who work with chronic back pain from a neuromusculoskeletal point of view. That's the big focus, as well as neck pain and concussion issues. I'd like to show you 2 attentional focus exercises you can do yourself once you've taken a posture picture to see how your body is, to try to connect your perception of how your whole body is balancing with the outcome of if you can balance better. If you feel your body is balancing better and you can stand on one foot and stay there for more than 5 seconds, more than 10 seconds. And as quantified by an interoceptive posture picture, of observing the deviations of your body. Connecting that balance, one, with 2 parts of your body alignment, where your head is and where your torso is. We call it forward head posture. You may call it tech neck, but if you spend a lot of time in front of a computer, which most scientists and researchers do, you'll probably find that your head is more forward of your body than your parents' head was when they were your age. In terms of some of the issues going on, if you take a picture of your kids, how they're standing and how their resting posture is, as opposed to yours is now. And if your kid's posture is worse than your posture is, it'll give you some insight on where the world is going. This young lady is a model. She had no back pain, no neck pain, college student. We did an event taking posture pictures. I told her to stand tall, show me your best posture, and just relax, stand tall. And this is what she did. Any way you measure where the head is versus the torso, from the back margin, from the center of mass, her head is translating forward, and you'll notice it's also going up. It's translating up. And that translation up is what happens because the muscles in the back part of the head become shorter. They compensate shorter, ultimately adapting shorter to restrain and constrain how the head is balanced on the torso. So looking at those 4 zones of postural mass, those 4 posture zones of head, torso, pelvis, lower extremity, the very first alignment exercise is wall lean. And it's really, really easy because all you're doing is having somebody lean against the wall with their feet a foot away from the wall so that their pelvis, their torso, and their head align with that vertical wall. You can do this at home with any vertical wall, but you want to take your feet away because you want to reduce the confounding variables of feeling where your head is over your torso. So first, aligning the pelvis and the torso against the wall and keeping the head level, look straight ahead. What you're dialing into is your perception of, is your head truly level in space? Have someone take a clear picture of your body from the side. It's a way to discern functional compensation from structural adaptation. So looking at her over here, you'll notice this, she was standing looking straight ahead, thinking that her head is level. If you looked at it from the back of her body, the margin from the back of her torso to the back of her head is quite a bit forward of it. And if you look at the face, it's looking up in the air. When I looked at her like this and I said, level your head and push it back towards the wall, that's what she did. When I went up to her and said, pull your head more forward, level your head, and externally put her head to level and let her push it back to the wall. And I made her stop at the limit to explore the limit of that functionality, what the Markov blanket is of that prediction, and stopping there. This is where this body truly is. Then told her to take 5 breaths. She was able to do it with a lot of focus, and that focus on keeping it level at the limit is what it takes to change bodies. Having her do that for 5 slow breaths 3 times a day will make a difference if she's being good about it, if she's being correct about it. And that's why working with someone to help you, could be a family member, to keep your head level as you're pressing back gently, not hard. Don't force it, because you want to remold tissue that's sensitive in the body, fascia. Don't push it. You want to be gentle. Gentle works far better than hard in this instance. You want to feel the tension. And when you breathe into it, it'll give a little bit. The imperative, what we call the must, or the must versus try, is to keep the head level. If you're looking at a side view, if your forehead is behind your chin, you're probably tilting up. If you're away from the wall, putting something behind your head, a pillow, an inflatable ball, to get a feeling of where the wall is and pushing back against that very gently, to build the awareness, to retrain that control. Awareness and control of your body and your environment is the center of the posturemonth.org ACE campaign, which is what we're behind, to improve people's ability to connect with their body, beginning with the awareness of the body and then strengthening the balance. Your posture is how you balance your body. This is what we're looking at with an interoceptive posture picture, just looking at how someone's balancing. How do you strengthen that? Holding that for those same 5 breaths when you're balancing with your body aligned to your body's perception. So finding a wall, standing tall, and dialing into what that feels like, and then locking in your knees, standing tall, engaging your core. Open your chest up, look straight ahead. Standing tall, kind of feel how that feels. Touch the wall, and keeping your outside leg locked, standing tall, simply lift the leg that's between you and the wall. And you don't want to lean into the wall. You don't want to lean away from the wall. You want to focus on standing tall, but you do want to barely touch the wall. You're going to want to say, okay, I can do it without it. I can do it without it. And the moment you do it without it, you've lost that feeling of inside your body. The moment you go from, I'm maintaining my balance, you're coming away from the feeling of standing tall. Standing tall, touching the wall, lifting the leg, and barely touch the wall. How light can you touch the wall and stand tall? And focus on the standing tall, because the information coming in to your body from that little bit of touch is the link to reality that lets you strengthen how you're standing. That will then help you strengthen your balance, tying those 2 links together. Simply tying those 2 links together is a huge first step in strengthening balance and alignment of your posture. And it's also an indicator that you can use when you take a posture picture, an interoceptive posture picture, to validate the alignment of that objectively, externally. Doing that along with people's bodies internally is a way to create changes in how people use their body in everything that they do. A lot of times people don't want to do this because I don't want to see it. It's too scary. Herbert Spencer was a noted British philosopher and sociologist. The profoundest of all infidelities is the fear that the truth will be bad. I hope to hear from you. I hope to work with you. If you have any questions, drop me an email. My name is Dr. Stephen Weiniger. Thank you for having me here, and I look forward to working with the active inference community with a clinical perspective to help people stand taller and move well. Have a great day.